Heart Health Check. Assess your cardiovascular health with QRisk Score. Key takeaways. Heart Health Check. The QRisk Score is an online tool that calculates your 10-year risk of cardiovascular disease based on evidence-based risk factors. Cardiovascular disease is preventable. Small lifestyle changes like eating a heart-healthy diet, not smoking, and staying active can significantly reduce your risk. Women over 50 at higher risk. After menopause, heart disease risk increases due to hormonal shifts, higher cholesterol, and blood pressure changes. Recognize symptoms. Learn the subtle warning signs of an unhealthy heart, such as fatigue, chest discomfort, or shortness of breath. Take action today. Use the QRisk Score to have a conversation with your GP or myself. Track your health and create a plan to protect your heart. Let's look at what cardiovascular disease is, why QRisk is so powerful, and how you can use this knowledge to take charge of your health. I'll share practical tips, relatable stories, and strategies so you can stay heart healthy at any age. Heart health check. As we age, particularly after the menopause, taking time to do a heart health check is so important. Our hormones and metabolisms change, and we get a little less active year by year. These can increase your risk of cardiovascular disease. But here's the good news. By understanding your risk, you can take preventative steps to protect your heart and master your cardiovascular health. One tool that can help us know our risk is the QRisk calculator. It's an easy-to-use online calculator designed to assess your 10-year risk of cardiovascular disease. You can also download my free guide to metabolism testing and cardiovascular health, created to help you understand the other things you need to keep an eye on. Download your free guide here. What is cardiovascular disease? Cardiovascular disease affects the heart and blood vessels. Cardio meaning heart and vascular meaning blood vessels. For example, heart attacks and atherosclerosis or hardening of the arteries. Often called silent killer, cardiovascular disease can develop over decades without obvious symptoms until a major cardiovascular disease event occurs. Think of it like a clogged pipe. The damage happens gradually until one day the flow stops. As the famous American swimmer and 28 Olympic medal winner Michael Phelps said, the problem with heart disease is that the first symptom is often fatal. For women over 50, not on HRT, the risks rise. The natural drop in estrogen, combined with metabolic changes and lack of appropriate exercise, can weaken the heart's defences. That's why it's so important to stay ahead of the game, and that's where QRisk comes in. What is the QRisk calculator? The QRisk calculator is a scientifically validated tool developed in the UK by the University of Nottingham to calculate your 10-year risk of cardiovascular disease. It uses a combination of these factors to give a personalised risk percentage. Age and gender, smoking status, body mass index and waist circumference, systolic blood pressure, total cholesterol levels, family history of heart disease, and existing medical conditions like diabetes mellitus, rheumatoid arthritis, or chronic kidney disease. The calculator also accounts for ethnic groups, recognizing that some groups may have higher risks. The QRisk score is endorsed by the National Institute for Health and Care Excellence, NICE, and is widely used in general practice and primary care settings for risk assessment. Pro tip, if you have 3 or more risk factors, give me a call to talk about it. Why women are higher at risk after menopause. Menopause brings several changes that can silently impact your heart. 1. Hormone shifts. Estrogen helps keep blood vessels flexible. After menopause, this protective effect gradually declines. Metabolic changes. Many women experience weight gain, insulin resistance, albeit unknowingly, and increased abdominal fat, all of which raise cardiovascular risk factors. 3. Blood pressure and cholesterol. Both often creep up after menopause, increasing strain on the heart. 4. Inflammation. Silent inflammation can accelerate the buildup of plaque in the arteries. I'll be talking about those blood markers in more detail in another blog soon. These changes may sound worrying, but they're not inevitable. With the right lifestyle modification steps, you can stay ahead of problems. A quote from Dr. Mehmet Oz, American politician, television presenter, physician, author, professor emeritus of cardiothoracic surgery at Columbia University. I saw many people who had advanced heart disease, and I was so frustrated because I knew that if they just knew how to do the right thing, simple lifestyle and diet steps, that the entire trajectory of their life and health would have been different. Signs of an unhealthy heart. Women often experience subtle or atypical symptoms, making early diagnosis of coronary heart disease tricky. So watch out for chest discomfort. That may feel like pressure or indigestion. Shortness of breath, especially during routine activities. Fatigue, persistent tiredness without a clear cause. Radiating pain in the back, neck, or jaw. Heart palpitations, a racing or regular heartbeat, and swelling in the ankles, legs, or abdomen. If you notice these symptoms, don't ignore them. Seek further information and medical advice promptly. Never ignore chronic symptoms like chest pain, shortness of breath, and tiredness. How to use the QRisk calculator. Using the QRisk tool is simple and empowering. Gather your data, so that's your recent blood tests for cholesterol, blood pressure readings, and information about your family history, weight, and height. Visit the website, go to qrisk.org and enter your details. Review your results. Your score will show your 10-year risk of cardiovascular disease. A low risk is less than 10%, a moderate risk is 10 to 20%, and a high risk is over 20%. Take action. Use your results to start a conversation with your GP or me about lifestyle changes or preventative measures, such as a statin initiation if needed. Meet Mary, a case study. Mary, a 55-year-old retired teacher, had always thought of herself as healthy. She enjoyed gardening, walking her dog daily, and ate fairly well. But when she heard about the QRisk score, she decided to do a heart health check. To her surprise, her 10-year QRisk revealed a 12% chance of developing cardiovascular disease in the next 10 years, putting her in the moderate risk category. After discussing the results with her GP, Mary made some small but powerful changes. She swapped her butter for olive oil, ate more vegetables and less animal proteins, started brisk walking 3 times a week, and worked on reducing her salt intake. A year later, her cholesterol level and systolic blood pressure improved significantly, and her QRisk score dropped. Mary's story is a reminder that knowing your risk can spark meaningful, life-saving changes. Steps to maintain a healthy heart. Here's how you can take charge of your cardiovascular health. Number 1, adopt a heart-healthy diet. 2 proven dietary approaches are the Mediterranean diet, think olive oil, nuts, seeds, whole grains, lean proteins, and plenty of colourful vegetables. Studies show this diet can reduce cardiovascular disease events by 30%. And secondly, the DASH diet. This focuses on fruits, vegetables, low-fat dairy, and whole grains, while cutting down on salt and processed foods. It's known to lower blood pressure effectively. 2. Get moving. Exercise is one of the most powerful ways to protect your heart. Aim for 150 minutes of moderate activity a week, such as brisk walking, swimming, or dancing. Even small increases in an activity can make a significant difference. 3. Monitor your health regularly. Schedule regular checkups with your GP to monitor blood pressure, cholesterol levels, and other key markers. Knowing your numbers is half the battle in primary prevention of cardiovascular disease. 4. Manage stress. Chronic stress can impact your heart health. Try mindfulness techniques like yoga or meditation and make time for hobbies that bring you joy. A quote from Dean Ornish, American physician and researcher. Think about it. Heart disease and diabetes, which account for more deaths in the US and worldwide than everything else combined, are completely preventable by making comprehensive lifestyle changes without drugs or surgery. QRisk update. Recent research led by the University of Oxford has built on earlier models. QRisk 4 provides an even more precise way to predict an individual 10-year risk of cardiovascular disease. It includes 7 new risk factors that reflect how other health conditions can influence heart health. These factors include chronic pulmonary obstructive disease, learning disability, Down syndrome, and 4 types of cancer: blood, lung, oral, and brain. Together, these highlight the broader connections between serious illnesses and cardiovascular disease. Additionally, QRisk 4 now identifies woman-specific risks for heart disease. For example, complications from high blood pressure during pregnancy and postnatal depression, which have been found to be strong predictors of future heart health challenges. Final thoughts. Your heart is in your hands. By calculating your QRisk score, you can understand your 10-year cardiovascular disease risk and take proactive steps to reduce it. Whether it's tweaking your diet, getting advice, or seeking guidance from your GP, small changes add up to big benefits. Remember, it's never too late to start. Take charge of your heart health today, because you deserve to live your best life full of energy and vitality. Thank you.